Okay,
Hi
doctor.
everyone, how are you?
Fine.
Oh, that's great. So I'm Dr. Zahid Afzal to share with you the basics of pets and the pets practice. So it will involve everything that you need to know about your practice, about your daily routine practices, especially for the cats and dogs and the exotic birds. Let's start. So everyone, once I will say that please uh, be careful and be listenable to my conversation, as it's very important for everyone. So we will start from my introduction that I'm Dr. Zahid Afzal, and my practices involves the 6 years of practice. I have experience of 6 years of veterinary practice, which is specialized in cats and dogs, and I have treated more than 20,000 cases up till now. And most of them, about 70% of those cases involves pet cases. This is the basics. This is the basic thing we need to know about your presenter. So my experience, I started my practice from General Veterinary Hospital, and this involves 2.3 years. That's almost 28 months. I worked here in the General Veterinary Hospital as a consultant, as a veterinary physician and veterinary surgeon. After that, I have joined Pakistan Army as a civil livestock consultant for 2.5 years, that almost 26 months. So after that, I was invited by Bahrain Army, the Royal Military Police, which you all know by the name of Shurta Askari. I worked about 18 months in the Bahrain Army, in Royal Military Police of Bahrain Defense Force, in their dog section. And now currently I'm working as a chief consultant at General Veterinary Hospital. General Veterinary Hospital basically is my own small animal practice. It's a small animal hospital which include all the sections and which includes almost all the facilities. And it is located nearby the Lahore Airport, Lahore International Airport. So I have access to all the clients and all my, especially the pets. And my specialities includes canine, the dogs, the feline, the cats, in their diseases, in their training, and in their psychology. So in the dogs, as I have told you that I have worked in the Bahrain Army, in Royal Military Police, and in feline, I deal with many thousands of cases of cats here in my General Veterinary Hospital, Lahore. And in their diseases, I have faced too much diseases in cats. I introduced many new diseases while observing the patients, while observing the cats, and when it's come to the training of these animals. So I have a vast experience in the training of cats and dogs, and the psychology. So basically, when you see a patient, when you have a patient, when you have a special cat and dog, so you need to know about their psychology also, as it's important that we need to know about his or her mental health. So this was my introduction, and I hope now we can continue to the course. So I want to introduce you firstly to the pets clinic, that introduction to the pets clinic. So firstly, we have management of the clinic. So how, but once you establish a veterinary clinic, a pets clinic, then what you need to manage that clinic. So firstly, it involves the clinic schedule. So when you are at a clinic at your own practice, so you need to make a proper schedule of sorry, proper schedule of your clinic opening and its closing, and the proper schedule of consultants who are visiting your clinic, and proper schedule of the staff who are visiting at your clinic. So second thing is very important, which is the timing. The timing is very important, as you know that when we are in a practice, in a routine practice, so we need to make appointments. We need to give appointments to different animal owners, to different pet owners. So here we need to manage the timing. So we need to schedule the timing. So we need to adjust ourselves to the timing. So the third, the most important thing is patient record. So every clinic have its own record pattern. So as General Veterinary Hospital have its own patient record, which I will show you after this course. I will introduce you with my staff. I will introduce you with my clinic, with my all the facilities I have. I will introduce you on the video call, on the video cam. You can see. So you will see the patient record. Patient record is very important. So once a patient came to you with a problem of headache, suppose. So on the very next day, when she or he will come again to your clinic for the same problem, you can search his or her history, and you can find that from which medicine she or he got cured. So you can again prescribe that medicine if the pet is having the same problem. So it's very important. So the amount and the payments and all the financial requirements are also mentioned in this record. So it's important that it's very important for your clinic, for your prestige, for the patient, and for the owner. So the lastly, we from the patient record, we can get a scheduled data in which we involve different types of contact numbers, so you can keep in touch with your clients, with your patients. And fourth thing is medicine record. So at every clinic, you need to keep medicine records, as you have medicine for your personal use, for your clinic use, and for your staff use. So you should have all the record, that which medicine arrived on which date, and which medicine is used on that date. So you need to keep and record, and also with the financial details, that how you get this one. Suppose, as most of us are from Egypt, so I will say that in EP, Egyptian pound. So suppose one injection cost us for 10 pounds, and the retail price is 20 pounds. So we can keep this in record. So we can manage this, and by this we can calculate our profit, we can calculate our inputs, we can calculate our outputs. So it's very important. And next step is staff. For the staff, when you have to manage the clinic, uh, the staff is very important, and the staff record is very important. So when you achieve your target, the staff record is also very important, just same as the patient record and the medicine record, in which you will calculate their leaves, in which you calculate their presence, their attendance, their salaries, their daily package, their pick and drop, and other facilities you can keep in record. So it's very important. So next step is reports. So when a patient came to you, when a patient came to you for a checkup, suppose we have a dog which is suffering from some viral disease. So after the examination, after the complete overwhelming diagnose, you will issue a report at which in which you will write all your diagnose, all your prognosis, and about the treatment of that patient. And in prognosis, you will also suggest that this patient will survive or have little chances of survival or have no chances of survival. And by this report will help the client, and this report will help you also. So when you issue the report, so you ultimately you are relieving your burden, and it have a psychological impact on the patient, on the owner. So the reports are also very important. So you have to keep a staff, so, which can manage the reports, who can write the reports accordingly, and by the prescription of doctor and by the guidance of the doctor. So uh, after that report, the doctor, the consultant will guide the owner uh, with his local communication ways, and issue the report by his stamp and by his signature. And invoices, as you know, that whenever we go to any shopping, and we go to any pharmacy, they issue us an invoice. So invoices are also very important. Either it's on a common paper, or either it's on your professionalized bill. Now the last thing is certificates. So every pet clinic have its different type of certificates. Some have a a pet book, which you known as the pet passports. So in which you have all the details of pet vaccination, pets deworming. They have any surgery, they have any disease condition. So you have all the certificates. So, but in at my clinic, uh, there are there are different certificates for everything. Just like a vaccination certificate, we issue a vaccination certificate that this dog, with this breed, with this sex, have a vaccination of this brand on this date, and the next due date will be this, and he is vaccinated against this, and this disease. Suppose in dogs, we do the vaccination of Biocan DHPPILR. DHPPILR stands for D for distemper, uh, H for hepatitis, I for influenza, P for parainfluenza, and P for parvovirus, and L for leptospirosis, and R for rabies. So against these six diseases, the dog got vaccinated. So we issue this type of certificate. For cat, there is a different certificate. For dog, there is a different certificate. For their other procedures, if we need, then we will issue the different certificates. So here we have the management of clinic, that how you will manage the clinic. So I will explain this step by step by viewing you the live view of my clinic, my hospital, my setup, and in which you will get a clear idea that how I'm managing this and how I am running this clinic. I hope you all are getting my point, and you're not getting bored. So the next step is the staff requirement. So whenever you open a clinic, you need a staff. So the first thing and very important thing is definitely the receptionist. The receptionist is very important for any clinic, and the receptionist will manage the front of your clinic. Purpose of staff: when you hire a staff, hire any person, you need to know by yourself that what's the purpose of this staff, what will be his working, what will be his job description. So you have a clear mindset that what she or he will do. So suitable person, that's mean the right person for the right place. So we need to follow this rule, that right person is at right place. And punctuality, make sure that your staff is punctual. And the final and the last thing and the most important thing, in any practice, in any pet clinic, or in any way, I must say that in even in life, that loyalty and honesty, it's very important, especially in our practice. We have many fraudulent activities. So we need to see that either the person is loyal, either the person is honest, and he or she is able to work with us or not. So this is the staff requirements. So basically, you need a receptionist, and you need, for a small setup, for a one doctor clinic, you need a receptionist, one assistant, one office boy, and one doctor. So this is the setup for only one vet clinic. If you have two, then you can hire the more. The more your requirement, the more will be your more will be your value of your practice. So let's come to the next step. What should we have in a clinic? So this will also, I will show you in my live view that what we should have in our clinic. When we open a or a pet practice, we need the separate rooms. We need a separate room for doctor, in which he can deal with the owners, with the pet owners, in which he can serve his privacy. Well, a separate office for the doctor, a separate treatment room for the generalized treatment room for outdoor patients, and a specialized operation theater, which is very important, especially for the surgeries. You should have a waiting area. The waiting area should be elaborated, should be more consumable, should be clean. So waiting area is the most important thing. When someone enter at your clinic, he will judge you. He will judge the doctor. He will judge your practice by visiting your waiting area. If your waiting area is perfect, then definitely the client and the owner will be quite impressed, and he will satisfactory go for the treatment of his or her pet. So the next thing is vaccination room. As you all are the veterinary graduates or the veterinary students or veterinary doctors, so vaccination room should be separate, because you know that vaccination is done only to the healthy animals. So whenever you have a separate room for the vaccination, it will encourage the owner to visit you again and again. So it's very important for us, for as a practitioner, as a private practice, as a practice clinic, that you have multiple visits of the patients. If you have multiple visits, it's not only will it not only will raise your standard, but it will also increase your profitability or a business in a business point of view. So the next thing is a separate ultrasound room, and in which you have ultrasonography equipments or machines. If you can afford an X-ray machine, so you can put it that in that room. As we have only ultrasound machine here, so we don't have a separate room, but in recommendations, it need a separate room, ultrasound and X-rays. Now, that last thing, what we should have in a clinic is diagnostic equipments. So whenever you have diagnostic equipments, so keep in mind that you must have all the equipments which are important and which are required by the patients, which are required during the diagnostics of the patient. So in that, you should have a thermometer, which is very important to maintain or to get the temperature of the patient. So the next thing is the stethoscope, so you can check the respiration. You should have a pulse oximeter to check the pulse and oxygen level of the patient. You should have a different type of forceps, different type of scissors, different type of surgical equipment, different types of syringes, different type of needles. You all need these things. So these are the diagnostic equipments. So now come to the most important thing. I hope everyone get the basics of management and how to make a clinic or how to run it, and what are the requirements. So basically, we are discussing the one part of this course now, and the second part will be discussed tomorrow. So now the next step, which I'm going to discuss, is the basics of physical examination. Whenever a patient came to you, so we need the temperature, that it's hypothermic, it's hyperthermic, it's normal ranges. We have to check it. So we have to check the temperature firstly. If the patient is hyperthermic, we will deal with him accordingly. If the patient is hypothermic, that temperature is lower, so we will deal with it accordingly. And the different normal ranges. Normal ranges goes from 100 to 102.5, as it is, it's in the reference values. But in a common, in a practical way, we have 101 as a normal temperature of cat and dog. If the cat and dog have 102, 103, 104 or more than this, then we will treat them according to hyperthermic treatment. So I will show you, and I will also show you that how to take the temperature. And I will show you. I will show you on the practically on a dog right now. Right now, I have a patient admitted in my hospital, a Labrador. His name is Beagle. He's very friendly dog. He's very cooperative. He's having a respiration problem. So I will show you for that patient. So the next step is respiration. Either we have to check that what's the respiration of the patient. Either it's quite fast, it's deep, or either it's shallow or it's slow. So normal range is 18 to 40 per minute. We have to check this. So whenever there is a deep respiration, then it means that the patient have serious issues. And if he have a shallow breathing, then it's mean that the patient have some tachycardia and bradycardia issues, as you all knew about these things. So pulse and heart rate. So it's also very important that these two things are very important. That either the pulse is fast, either the pulse is very slow, and normal range 80 to 140 for cats and dogs specifically. So by the pulse rate, we can judge, we can diagnose the exact condition of the patient, we can diagnose the exact the disease of the patient and the condition in which he or she is suffering from that. So the next, diagnostic by the physical exam. So here I want to increase your knowledge that by don't going uh, to a physical to a lab analysis, to the lab exam, we will examine the animal by their physical exam. So I will show you that how we will check the physical conditions. So, number one, the first thing we need to check for a patient, its eyes. That we will check the eyes of the patient. Either we will check its dehydration level. If the eyes are sunken, if eyes are deep inside, then this means that animal or the pet is suffering from the dehydration. If the eyes are pale, then it means that animal is having anemic condition or a liver issue. If it's quite red, then it means that animal is having an acidity or stomach issue. If it's yellow, then it means that the animal is having hepatitis or jaundice. If it's pink, then it's normal. If it's white, then it means that animal is suffering from the anemia. Anemia, that means the deficiency of blood level. So identification by the body condition, and remaining things we can identify by their body condition of the pet. So the next step is mucosa or gums. So we will check the mucosa or gums of the dog. Either it's pale, pink, white, yellow, or red. The same parameters will be applied on the same condition like as eyes. So the next thing is skin. So we will check the skin. Either it's rough, it's dehydrated, it's stiffness, it's tegument, non-tegument. If it's rough, then it means the animal is dehydrated. If the skin is loosey, then we will see that animal is not suffering from the dehydration. If animal skin is soft, then it means it's normal. If it's hard, if it's quiet, it takes times to come at the normal position, then this means it's a dehydration case. So the next step is walking gait, that how an animal is walking. Either it's working normally or it's abnormally. And external wound and abrasion. We will check the presence of any wound. Is there any wound present or not? If it's present, then what's the condition of the wound? What's the condition of the abrasion? Either it need a surgery, either it needs something else. So this is all I have. Now I would like to show you my clinic. I hope everyone is ready. Should I start?
Yes, doctor.
Okay. Now I will go outside for my clinic. Okay, I hope you won't mind. Just give me a few minutes. Now I will give you the practical demonstration, the practical evaluation, that what's the clinic and what we need and what we have. So this is my office. From here you will start. This is the front gate, front elaboration of the clinic, and it's the outdoor clinic, outdoor patient checking area, where you will check the normal patients with the normal conditions, and beneath that you have a separate kennel for the dogs and cats for admission purpose. And here you have the fee chart, where we written up the fees of the different animals.
Dr.
And here
Zahid,
it's
Dr.
a
Zahid,
hall.
you
Yes, yes.
can open a back camera.
Sorry.
You can open a back camera.
I can't see. I can't hear you, and I can't get your point.
Yeah.
So this is our reception table, where we manage the record. I have to show you different records, so that's why I'm showing you this. So here is, we have the patient record. So here we have the case number, this one. Now the case number is going on 10064. That means at this clinic we have checked 10,064 patients. So at this we mentioned the name of owner, we mentioned the amount we have taken, the patient we have checked. Here the doctor write his remarks, and here is the contact number of that owner. So this is the patient record. So similarly, we have different reminders that this owner have a different type of vaccination. So this is our prescription, where we write the owner name, dog age, dog weight, animal breed, or animal breed, and the case number which I showed you, that case number. So here we write the diagnose. Diagnose is fever and anorexia with weakness and lethargy. Repeat visit for 3 to 5 days. And here we write the treatment. That is syrup augmentin 156 mg 3 cc 3 ml after every 12 hours, continuously for 5 days. Soap Hapamas 1 ml after every 8 hours, continuously for 11 days. Syrup Zufin 3 ml after 3 hours, continuously for 3 days. Syrup Entamizole, and similarly we will mention the drugs. And here you will finally you will mention that the signature stamp date of the authorized veterinarian. So this is the prescription, and now I will show you the vaccination certificate for the dog. So this is the certificate. So this is the certificate of the dog for the vaccination against these diseases. Against these diseases, the dog is vaccinated. This is the dog name. This is the breed. This is his sex. This is the number of diseases. This is the vaccine name. This is the immunity period, and this is the next due date. So this is the certificate. And now we will start again with the invoices. Now this is the invoice. So it's the owner name. Similarly, the credentials we mentioned here. So we have mentioned here the different credentials that so here we mentioned the different categories that what is the checkup fee, what we give him, so all the categories, and after that we have made an invoice. So that's it. We have to make invoices, and I told you about the certificate. I also told you about the medicine record. So I will tell you about the medicine record we are taking. I hope not everyone getting bored by this. It's long, but so this is the list by which price we get this and how much it's sold, and which is the name of the product. So this is the record. It's known as the medication record. So here we have different categories of the cat foods. We have different categories of the shampoos. We have different categories of foods. We have different categories of the tick spray, the different things which we need in any clinical practice. So it's a hall. I know that it's a small one, but it's quite helpful for me and for my practice. There you can see that different type of litter scoops and different types of the leashes and the collars and the chains. These are the things which we need in a practice, in a private practice, which is very important for that. So here we have our treatment room. This one is the treatment room where we have the bridge stand, where we do the flood therapies, where we do different things. So here we do the ultrasonography of different animals, and there are we do the different ultrasounds. So here is another patient we have admitted here, which I will show you the basics of physical exam. So let me call this dog out. जब थोड़ी देर वेट करना पड़ेगा तुम लेक्चर चल रहे हैं मेरा फिर उसके बाद आप अंदर आ जाए इधर वाला वो मसला नहीं है लेकिन ये ज्यादा है ना तकरीबन 200 के करीब डॉक्टर्स बैठे हुए हैं जो सुन रहे हैं so here you can see the dog come good boy so this is the beagle. This dog is admitted here, and he is a good lovely dog, and he's having some respiration problem, and he's having some vomiting problem. So I will show you that how to polite sound. Good boy, good boy, good boy, good boy, good boy. Sit. Whenever you see a patient, always be polite to him. be conversations to him, and he will cooperate with you. This is his first time. He is with me right now. Sit, look. He's got sit down by polite way, by no any hurdles. So we can do anything. We can do checkups. Even I can give injection at this condition. So what we will check firstly, we will check the temperature. How we will check? We will check from the anal opening by inserting the thermometer, and here here we have the thermometer, the digital thermometer, which gives us the proper reading of this. So after checking the temperature, look at his respiration rate. It doesn't give a look that he is suffering from anything. And look, he's coughing. So by the respiration or by the coughing, you can see it. By the use of stethoscope, stay boy, come, boy, come. Beagle, hi, very good. Come here, come. So by the use of this stethoscope, you can check his respiratory rate, you can check his all the conditions related to the specifically for the respiration. So now come let's the pulse. So here by this point, you can check the pulse. It's a tail, the main neural vein going on here. So we can check the pulse here. So if you sit down, then I can show the participants. Look, come here. Look at his eyes. His eyes, you can see the mucosa inside the eyes. Okay, you have to look the mucosa. After that, you will check the stay boy, stay. You can see the gums, mucosa, and by the teeth and by the yellowness of the teeth, you can determine the age of the dog. So this is the dog, and what we have the next, the skin. You can see his skin is quite soft and going back to its position within a few seconds. So that's mean the animal is not dehydrated at all. So we have seen there is no abrasion on this patient. So what's the basic problem was? The basic problem was that the owner is complaining about his coughing, that beagle have cough and have a continuous cough. So whenever you have a patient, you have to check these points: the temperature, the respiration, the pulse. And by the physical exam, you will check the eyes, you will check the gums, you will check the skin, you will check the respiration, either if it's present or not, and you will check the abrasions, you will check the wounds. Is there any wound is present? And you will check the gait, the walking of the dog. Look, he's perfectly all right. Nothing is wrong with him. He's perfectly all right. He has nothing to do with the walking. So we can easily go for the treatment of his respiration only. So now we will have a look. Somewhat. Hey, what? Go. So he will be our guest for 5 days. Now there are different type of antibiotics we are using. This is gentamicin we are using. This is enrofloxacin we are using. This is the anesthesia we are using. This one is a multivitamin we are using. This is the meloxicam for the pains, for the rest, for the different type of diseases. So here we have syringes. We mostly use the 3 ml syringes here. We also use the 1 ml syringe. We also use the polythene gloves, cotton, the ultrasound. Our detailed course, I'm thinking about the course of about ultrasound that I will start this course very soon. if you all guys like this course, then after that I will introduce you about the ultrasound course. So here we have different types of tablets. If we need to give the tablet to the animals, then we will give this one. So this is the syrup form, which is available at our clinic. These are the different types of injections, different types of syrups, and at the upper side we have the nebulizers. We have different type of injections. So it's our indoor pharmacy. It's an indoor pharmacy. So we can say that we have a small animal hospital, although we have another area right behind this door, which is the grooming area, which is the cleaning area. Where we cut the hairs, where we used to run the saloon for the pets. So let's come to the office. We'll discuss it further. So don't forget to sanitize after checking the patient. Either it's normal or it's not normal. So let me. So here is the course, a first part of the course, which I introduced you about the basics, and I also gave you uh, the physical and the practical evaluation of a patient, that how we will check it, patient. So, if anything, if any question regarding this, you can ask me. I just have a patient with a wound, with a maggot wound. If you guys wanted me to show you that patient, then I can also show you with the maggot infection. If there is any question, you can ask for me for today.
Thank you, doctor. Any question? Thank you very much for this great lecture, Dr. Hafs. لحظة. دكتورة دنيا.
Assalamu alaikum. Assalamu alaikum wa rahmatullahi.
In English,
Thanks, doctor, for this lecture. I want to ask one question, please. What is the most important in the clinic, the X-ray or ultrasonography? And thank you.
Thank you very much, and it's a very nice question. Basically, it depends on the availability of your resources. If you have the resources, you can afford the X-ray, then it's very important. And if you don't have the resources, you have a lesser resources, then you must have ultrasonography. Ultrasonography is basically for the soft organs like the heart, like the kidney, like the intestine, like to check the pregnancy. But the X-ray machine is only for the hard structures like the bones, like the head, like abdominal structures. So you have to look before that what type of patients you are getting. Either it's mostly wanted to diagnose
معلش يا جماعة النت علق تقريبا عند الدكتور، فهو هيخش تاني دلوقتي إن شاء الله. Welcome, Dr. Zahid.
Hi, sorry, my call was dropped due to the battery issue.
Nothing, Doctor.
So, so I was telling that the difference between the ultrasound and difference between the X-ray machine. So, when you are having the patients for the X-rays for the mostly with the bone structures, then you need an X-ray machine mostly with you. And if you are facing the mostly patients with a pregnancy diagnosed, so you need an ultrasound machine. Yeah, I got another question from the Dr. Iram.
Yeah.
Okay, so Dr. Iram by herself is a PhD in pathology, and it's honor for me that she's asking from me. Doctor, we mostly use the drugs in the respiration. If you're saying the symptomatic drugs that we use mostly dexamethasone, we use the steroids. The most priority steroid is the dexamethasone, and the second one is you can say the prednisolone. So these are the basic two drugs which we use in the pets, and the remaining we use the antibiotics and specific antibiotics, which depends on different types of conditions, which includes the gentamicin, which includes the enrofloxacin, and which include the different things. So here is your answer. And the next question I got, I don't know. Please let me with the first, the Maram Imam, how to deal with the aggressive. Yeah, it's very simple. That you need to be polite. Always keep your face smiley, and always keep your attitude towards that you are liking the pet. Taking him as a human, not as a pet, because it's not an animal, it's a life. So when you will deal with the pet just like as a human, so it will treat you accordingly. So there are some breeds which are quite aggressive, so you use to hard hands with them, just like the gripping of by the neck area, this area, the subcut of this area. By this area for the cats, this is the painful area, and by the jaws for the dogs. So you can handle by this, and by using the mouth gauge, you can keep the animals handled. Or always remember one thing, that always protect yourself, cure yourself firstly, then after that check the patient. So I was checking the Labrador. So as he is the playful dog and he don't bite, so that's why I go fearlessly with him. And so you have to be careful. And if there is a dog which is very aggressive, like Rottweiler, like Doberman, these are the aggressive, like pit bulls, American pit bulls, that bullies. So you have to be careful and ask the owner to grip the patient, to grip the pet. For the beginner, how much for making a pet clinic? It depends on the area, it depends on the country, it depends on the many factors, that what type of facilities and how much facilities you are giving to your to your pets, and uh, what we can't calculate. It's according to you. Like in the Bahrain, as it's a Gulf country, so when we establish the clinic, so the roughly you need in US dollars, maybe you need $7,000, about $8,000. But in Pakistan, you can start it from the $100,000. Sorry, for the $1,000, you can start it with it. It's a minimum cost. You can start with a small setup, and after that you can increase when you have different type of patients, when you have the different type of luxuries, then you can start it. Could you tell us more about the paralyzed cases? So can we use the other drugs instead of steroidal, because steroidal drugs are dangerous? Yes, we can use, but for the respiration, it's very important. So we inform the owners about the concerns. So we inform the owners about the risks present in the use of the steroidal drugs. And if owner is not willing, then we can use the anti-allergent, and we can use some of the bronchodilators. We can use these drugs if owner is not agree on the steroidal drugs. The next question is, could you tell us more about the paralyzed? Sorry, I will not be able to answer this question right now, because tomorrow we have the second part of this course in which we will discuss the diseases. So I can easily guide you about the paralyzed cases. So I can show you some paralyzed cases if I have tomorrow. So the next question is, I have seen goat in your record for mate. It's I didn't get this point from Ahmed Selmi. I have seen goat in your report for mate. Is it close to management of pets? If you are asking about the patient record, yes, as management of pets, for management of the pets, for the management of clinic, it's very important. In treatment of the internal parasites, the treatments are general for all internal parasites, or take samples for example firstly, then treatment. Yes, definitely, you have to examine. But if you don't have any facilities, then you can use the generalized dewormers. You can use the generalized anti-parasitic drugs to kill that specified. But if your owner of the pet is very concerned about the about the health of his pet, then if he can afford, then you can go for the test, for the centrifugation process. You can get the exact results, that how to diagnose, and which type of drug will be effective on the will be effective against a specific parasite. I hope you will get my point. Sorry, Ahmed, still didn't get your point. You wanted to ask me about the digestive diseases and the skin diseases of the pets. If it's so, then tomorrow I will discuss the diseases of these animals, these pets. I will discuss it tomorrow in the second part. Is there any question? Yeah, thank you so much. Also, tomorrow we will discuss the diseases with a complete detail.
Thanks, doctor, for this lecture.
Okay, all we done?
All we done. Yeah.
Thank you so much. Thank you so much. Thank you.
We done, doctor?
Thank you. Thank you so much. Thank you. Okay, Dr. Khalid.
Yeah.
I have your permission, because my 3 patients are waiting outside for me. So let me show you the patient with the maggot wound. If my participants wanted to see, we will discuss it about tomorrow.
Yeah, doctor.
Yeah, this one is the patient with the maggot wounds. So this is all we discussed for the today. Now I will need your permission to check the patients, and inshallah we will see you tomorrow for the next part of this course. I hope you enjoyed all these steps and you will follow these instructions, and it will help you out to make your own practice, make your own veterinary clinic, and to make yourself specialized in the pet practice.
Thank you very much, Doctor.
Thank you so much.
Thank you very much.
Allah Hafiz. في أمان الله.
في أمان الله. حد عنده أي أسئلة أو استفسارات أو أي حاجة؟ تقدروا تعملوا ريز هاند طيب وتسألوا، عشان بس الجروبس وكده ما بتبقاش لحد ما بتوصل حاجة يعني. Any question? طيب حد عنده ملحوظة، حد عنده حاجة عايز يقولها أو حاجة؟ عشان بس أنا بيجيلي أسئلة كتير في البرايفت يعني وكده. لا هو قال إن هيتكلم عن الديسيز بكرة، هو بس بيوريكم الحالة اللي عنده والكلام ده، وهيبقى يتكلم عن الديسيز بكرة يعني. حد عنده طيب حاجة طيب في الجروبس مش فاهم حاجة، لأن أنا فتحت مثلا ميتنج لقيت فيه أكتر من حد بيبعت لي الميتنج ويتنج ومش عارف إيه، فويتنج يعني أكيد هيتقبلوا يعني. نقطة تانية اللي مش مسجل اسمه المرة دي دخلوا عشان بس أول مرة وكده، إنما بعد كده بيكون ويتنج ليست ومش بيدخلوا، بس عشان المرة دي بس أول مرة يعني ما كانوش يعرفوا الطريقة وكده، فبالتالي الاتش ار سمح لهم النهارده يعني. طيب حد عنده اي استفسار؟ بالنسبه للناس اللي بتكتب شاتنج، ممكن لو مش قادر توصل معلومه او تسال السؤال بشكل كويس ممكن تقدر تساله فويس. الكورس لحد امتى؟ الكورس هيكون اليومين بس، النهارده وبكره، ولو عايزين اي اجزاء تانية ممكن ابقى اشرحها لكم يعني. حد عنده اي استفسارات تانية؟